Hello everyone, this is Dr. Richard Fleming, and today is Wednesday, September 23rd, 2020. For those of you who've been following my YouTube channel, as I've been talking about COVID-19 and the reasons why people are dying with the virus, I think you'll find the news that was just published 2 days ago in Science Translational Medicine to be extremely interesting. As you know, I've been emphasizing that the reason why people die with COVID-19 is not so much the fact that they have the virus as much as the immunologic response to the virus, the body's defense mechanisms. In older individuals with comorbidities, there's a lot of speculation about why this happens, although I have stayed firm to the fact that these individuals have hyperactivated immune responses. And they are hyperactivated because of diseases already existing in their body, diseases like obesity, advanced age, coronary artery disease, cancer, high blood pressure, diabetes, all diseases that produce an inflammatory response to begin with. For these individuals, they are prone to an increased inflammatory and blood clotting response, something that I call InflammoThrombotic response to COVID-19. That is to say, they are already in an inflammatory response due to these diseases. And when they become infected with COVID-19, that immune response is increased above and beyond what is expected in a normal individual. 2 days ago in Science Translational Medicine, researchers out of Albert Einstein University, Montefiore, and Yale University, and several of the departments at these universities, published a paper looking at pediatric patients and older individuals who did poorly. The researchers in this paper discovered that the older individuals who did poorly had increased levels of antibodies, very similar to what we've been telling you about with the hyperimmune response. This increase in antibody titers is associated with the release of chemicals that cause damage to the body that result in the inflammation and blood clotting. It's nice to see confirmatory evidence from somebody else simply looking at the outcomes of individuals who did well and who did poorly. The researchers go on to point out that this is related to a dysfunction of the innate immune response. That's that initial immune response. And I've been cautioning about this because this is where we're going to see people do well or poorly. In fact, I've been emphasizing the significance of getting treatment started sooner than later in these individuals, because once the innate immune system kicks in, the damage is beginning to occur. Quote, researchers of our study indicate that the poorer outcomes in adults were not attributable to a failure to generate T-cell or antibody responses to the virus. In fact, they commented on the fact that these individuals, quote, the finding that adults who did poorly had high titers of antibodies that were both neutralizing and induced phagocytosis, as well as a greater T-cell responses, suggest that boosting of these functional responses to the spike protein, particularly late in the course of the disease, may not be beneficial. In fact, we've emphasized the importance of addressing this early on in the treatment regimen. As some of you may remember from a recent video that I posted, we have submitted several papers for publication, and in one of those papers, we look at the fact that some patients who received hydroxychloroquine and zinc did poorly and required hospitalization. These individuals responded favorably to treatment with interferon and tocilizumab. This is part of the initial innate T-cell cytotoxic response that is dysfunctional in this group of individuals, and not only allows us to safely treat and effectively treat these individuals, but to prevent their deaths by controlling the immunothrombotic response.